And good evening, good afternoon, and good morning. This is the 2166th day of continuous webinar conducted by International Forum for Promoting Homeopathy. Today, our guest is Dr. Asha B.Varghese. Let us begin the session with 1 minute silent prayer. Thank you all. The International Forum for Promoting Homeopathy comprises of homeopathic lovers, students, and doctors, and we have 3 sessions every day. The first session of the day is already over in Hindi from 7:30 to 8:30, and from 8:30 to 9:30 we have the international session in English, and from 9:30 to 10:30 we have a local language session in Malayalam. We are uploading the videos of the same on the very next day itself so that those who missed the session can watch it again. You can subscribe the same without paying any money, and you can share it with anyone who loves homeopathy. The purpose of this forum is to take homeopathy to every home around the world. And today, our guest is Dr. Asha B.Varghese, and doctor has completed BHMS, MSc, and CFT, and practicing in Bangalore at Ambadi Homeopathy Clinic, and is the present was the former president of IHMI Bangalore unit and the vice president of Karnataka Iconic Women of Homeopathic Bharat. And she has more than 25 years of clinical experience, and she is having a legend in her mother, that is Dr. Remadevi Ambadi, who has been practicing for so more than 55 years in Kerala, and and is the mother of more than 2,000 children. So that's what all about Dr. Asha B. Varghese. And let me come to the topic. She has presented so many sessions in this forum. Today, she is coming up with one more session on female complaints, and that is management of menstrual irregularities with homeopathy. As we all know that homeopathy can do wonders in the treatment and management of women's diseases. Not only women, but or be the disease, we can go ahead in that way. So we proudly welcome our guests of the day, Dr. Asha B. Varghese, to the session. Welcome, ma'am. Yes, you can unmute. You can unmute. You are co-host now.
Yeah. Thank you, sir. And we just finished with a wonderful session. Frankly, even I did not want Dr. Prasad to stop his lectures. It was so wonderful. I'll start with my screen sharing. So today we are taking up a topic, menstrual complaints. So I've covered up majorly as many as I can, Metrorrhagia, Menorrhagia, everything. So we will start with, am I audible, sir?
Everything fine. You can go ahead.
Yes, sir. So we will start with the first topic. Just a second, sir.
After everything fine, menstrual disorders, you can unmute yourself and go ahead.
Just a second, sir. There's a tab that is like, covering it up. I'm not able to see it completely. It's getting stuck. So let me start with the menstrual disorders. About 70% of women menstruate at a regular interval of 28-day cycle, but some women may experience slight early or delayed menses. So minor variations are normal. So plus or minus of 5 is considered as normal. And what are the causes? The causes, either it can be hormonal causes, or it can be because of an inflammation of the uterus or a uterine congestion, abnormal uterine contractions, endometritis, endocervicitis, uterine fibroids or tumors, or sometimes cancerous growths of the uterus, or extreme cold and damp exposures can also lead to these kind of complaints. In cases like frost bites, etc., like we have heard of agaricus, even those kind of conditions can lead to menstrual irregularities. Next is an emotional stress. It can be anger, or it can be any kind of an emotional stress, especially in the with PCO, etc., we have seen that children with high emotional distress, they are, have a tendency to have menstrual irregularities more than the calmer children. And repeated mechanical abortions, anemia, metritis, or the uterine infections can be another cause of menses irregularities. Just a second, sir. Having a bit of a problem seeing the slide.
Yes.
Yeah.
Directory of Diseases and Cures. That is
Yes, yes. 1 second, sir. I've just gone down a little. So what are the different kind of menstrual irregularities that we see? The first one is amenorrhea, or the complete absence of menses. Second one is dysmenorrhea, or painful menstruation. Menorrhagia, or heavy menstrual bleeding. The next one is Metrorrhagia, or bleeding in between periods. Scanty menstruation, delayed menstruation, early menstruation, profuse menstrual flow, or watery menstrual discharges, prolonged menstrual bleeding. See the different types of menstrual irregularities we see in women generally. So what are the cures? First, let us see for what are the medications. I'll just cover up all the medicines in general, and eventually we will go for the medicines one at a time. First, menses before proper age, we can consider Antium crude, Calcarea carb, Calcarea phos, Carboveg, China, Cocculus, Ipecac, Rustox, Sabina, Silesia, and even Baratramal. So again, it is always important to find a constitutional medicine, but these kind of tips kind of helps us to look more towards those medications than having a vast array of medicines. Next, delayed tardy scanty flow of menses. We can think of Aletris, which is like a uterine tonic, Epis, Calcarea phos, causticum, Simicifuga, conium, dull camera, ferrum phos. Again, the anemia part will be covered up. Gelsemium, glonine, graphitis, helleborus, ignatia, kali carb, kali moor, kali phos, magnesium carb, natrum moor, nux moschata, and pulsatilla. Delayed tardy menses, pulsatilla generally, we give it in a higher dose. Is the speed fine, sir?
Yes, yes.
Okay. So what is menorrhagia? Menorrhagia is a regular menstrual period with excessive blood loss or prolonged duration of menses. So either the person has lots of, the bleeding is quite heavy. Like they change around 3 to 4 pads or 5 to 6 pads in a day. And they say that it is completely soaked in blood, or it can be prolonged duration, in the sense it can be more than 7 to 8, 10 days, 15 days. The prolonged menstruation is called menorrhagia. Clinical features. So whenever we have menses, first we should understand whether it is menorrhagia, metrorrhagia. The terms are very important sometimes even for a repetization. So therefore, the clinical features are bleeding lasting more than 7 days, soaking 1 or more pad or tampons every hour for several hours. So we have people sometimes complaining that either the tampon or the menstrual cups are getting filled up very fast, and they have to use extra precautions. Passing large blood clots, even sometimes as big as your palm, and associated with this is anemia and fatigue, weakness, dizziness, and sometimes shortness of breath. So these might be symptoms associated with anemia, which is the dizziness and shortness of breath. And we have to check for their hemoglobin, and 2 times, that is once as soon as the menses is over and once just before the menses starts, so that we can understand whether they are generally anemic or the anemia is because of the menstrual flow. Second one is serum ferritin has to be checked to see how the ferritin level is. This is again done twice if possible. What are the general homeopathic remedies? We will be going, each medicine, we'll be going for it in detail later. I'll just tell in short all the medications. Aletris, aloes, ammonium carb, ammonium brome is the 4th medication, Ars, belladonna, borax, Okay. So borax is a wonderful medicine. If there is heat feeling or the discharges are slightly warm, etc., we can think of borax. Cactus is there. Calcarea carp, Cannabis indica, Cantharis, Carboveg, Polyphyllum, Chamomilla, China, Cinnamon, Cocculus, Coffea cruda, especially if there is any patients who have sudden, a sudden use, etc., by which the menorrhagia starts, or we can even think of coffea. Next one is Crocus, Sativus, digitalis, erigeron, ferrum phos, ficus, geranium maculatum, Hamomilis, Helonius, Ipecac, Ashoka or Genosia ashoka, Creosotum, Millifolium, Murex, Acid nitricum, Nux vomica, Platina, Plumbum if associated with severe constipations, etc., Sabina, Sicelicor, Sidumtel, Sepia, Stanamet, Thalassobursa, Trillium, Eustilago, Xanthocylum. So sedum is generally given for menorrhagia with dark passive hemorrhage. Xanthocylum is a very good medicine for dysmenorrhea. So I'll just tell in detail later again a few of the medications probably which is not generally used much. I'll just try to explain in between. Shall I go to the next slide, sir?
Yes, yes.
Okay. Am I too fast?
No, no, no.
Okay.
You can go the same way. Otherwise, sometimes it may not be able to, you may not be able to complete the session.
Yes,
Okay.
sir. So next one is intermittent flow of menses. It refers to bleeding that stops and starts repeatedly with intervals in between. So you have menses starts, then again stops, again starts. So in between, there would be a slight gap. Again, it starts. So this is called an intermittent flow of menses. We can think of medicines like Ambrogracia, Epis, Apocyinum, Argentum nitricum in very anxious people, Calcarea carp, Calcarea phos again, Colophyllum, Simicifuga, Cocculus associated with giddiness sometimes, Cyclamen, Ferrum phos, Graph, Helonius, Ignitia, Iodum, Ashoka, Creosotum. See, Creosotum I generally prescribe for people who are a slightly a fatter version of phosphorus, like, generally with itching, etc. This is one of the good medications. And for earlier for menorrhagia, I had a very good case in which the person cured very well with Bovista for the bleeding. I just forgot to mention it. So in one of the cases, this person had pause and it was not stopping. So I gave Bovista, after which according to her symptoms, and the menses stopped, and she's still on medication for her irregularities with big clots, etc. This is another beautiful medicine. So generally, my choice would generally have been something like Sabina and all. And when I took up the medications, the repetrization, Bovista was a very wonderful medication, which has cured it considerably. Then comes Ambrogracia for intermittent bleeding, Epis, Apocyinum, Argentum nitricum, Calcarea phos, Colophyllum, Simicifuga, Cocculus, Cyclamen, Ferrum phos, Graphitis, Helonius, Ignitia. So Ferrum phos, again, 6x potencies. I gave it during whenever they have spotting in between menses, etc. So Ferrum phos 6x, 4 pills 4 times generally works quite well. Iodum, J. Ashoka, Creosotum, Lilium tick, Millilotus, Murex, Nux moschata, Nux vomica, Pulsatilla, Sabadilla, Senecio, Pulsepia, Sulfur, Trillium, Eustilago, Xanthocylum. Go to the next slide. Now the endometritis. It is an inflammation of the endometrium, which is the inner lining of the uterus, caused by either a bacterial infection So what are the causes? Generally, it happens after childbirth, that is a postpartum endometritis, after miscarriages or abortion, following certain gynecological procedures like DNC, as part of the pelvic inflammatory diseases. The endometritis or the inflammation of the endometrium can happen. What are the common symptoms? The common symptoms are lower abdominal pain or pelvic pain. Fever will be there. So whenever there is itis, there will be fever, inflammation, foul smelling vaginal discharges, abnormal uterine bleeding, and uterine tenderness can be seen. So the general medicines given is aconite as an acute onset, Apis mellifica, arnica after DNCs, and we can even think of Staphylococcus aureus during this time. R-salp, belladonna, borax, calcarea carp, cantharis, simicifuga, china, conium, gelsemium, graphitis, helonius, hydrastis, iodum, kali bike, kali carp, creosotum, lachesis, murex, acid phos. With severe tiredness, weakness, etc., we can think of acid phos, pulse, sabina, sicelicor, Telia europeum. So Telia is generally given for dysmenorrhea with and metritis, etc., with in nervous individuals. Eustilago, Veratrum, again with severe weakness. Now, what is Metrorrhagia? It is a bleeding from the uterus between menstrual periods. And what are the key features? Irregular timings, occurs between expected menstrual cycles. It can be light spotting or heavy bleeding. So this is what is Metrorrhagia. Metrorrhagia in between menses, between two menses, if you have a bleeding, either it is small spottings or it can be heavy bleeding, we call it Metrorrhagia. Menstrual flow itself may otherwise be normal. So they have proper cycles, but in between the menses, whenever there is spotting or there is bleeding, it can either be 1 or 2 drops came, or it can be continuously 4-5 days. I have menses, in between menses, I have bleeding. That is called Metrorrhagia. So what are the general medications prescribed? One is Ambrogracia, Apis mellifica, ammonium ars, Belladonna, Bovista again, Cactus, Calcarea carp, Colophyllum, Chamomilla, cinnamon, Crocus, Erigeron, Ferrum metallicum, Ferrum phosphoricum. So as I said, for Metrorrhagia generally, this is one of my best biochemic I gave. Hamomillus, Helonius, Hydrastis, Ipecac, Ashoka, Creosotum, Lachesis, Lilium tic, Millilotus, nitric acid, Nux vomica, Platina, Plumber metallicum, Pyrogen, Sabina, Sepia, Stramonium, Thalapsibosa, Trillium, Eustilago, Viscum album. Eustilago, I generally think of Eustilago more during menopausal issues. Like, one of my favorite medicines is Eustilago. Next is suppressed menses. For suppressed menses, we can think of aconite. If there is any history of, there was one of my case in which there was a history of accident after which the child did not menstruate at all. So aconite in a very high potency was given, after which the discharge started appearing. Initially, it came as spots, very irregular periods, and then it started becoming all right with good exercise. There are other diets and regimes, of course, we have to look into. Aletris, alumina, Apis mellifica, bryonia, Colophyllum, chamomilla, Chionanthus, simicifuga, cocculus, conium, crocus, cyclamen, dulcamera, euphrasia, menses lasting 1 day. We have seen this rubric in euphrasia, gelsemium, glonine, graphitis, helleborus, helonius. Helonius can be thought of even in PCOS, like with insulin issues. Helonius is another medication which is very good. Ignatia, J. Ashoka, Kali Kar, Kali Moor, with discharges, Kali Phos, Kali Sulf, Lachesis, Lilium tig, Macarp, Millilotus, Natramur, Nux moschata, Oleum animalis, Opium, Platina, Pulsatilla, Sicilicore, Senecio, Sepia, Sulfur, Eustilago, Veratramal, Viburnum opulus, and Xanthoxylum. So what are the medications generally given for threatened abortion? Aconite, arnica, belladonna, caulophyllum, china, helonius. This is millifolium, sabina, sicilicore, trillium. This is another very good medications for one of the best medicines which I used to use for threatened abortions. Trillium, Viburnum opulus, another one. Miscarriage from disability or weakness. What are the medications? Aconite, Aletris. Aletris, and usually Aletris is one of the medicine which is used as a uterine tonic. And one more medicine is there, which is a uterine tonic. I don't know, not many must have heard. It's Michella repes. That is also one of the best medicines as a uterine tonic. Michella, that will come up later. Belladonna, China, Helonius, Sabina, Trillium, Viburnum opulus. Bright red menses gushing out from least exertion, Apis mellifica, Bovista. Calcarea fos, Chamomilla, China, Cinnamon, Erigeron, Eupion. Ferrum fos, Ipecac, Medorinum, Millifolium, Mitchella, Phosphorus, Sabina, Sicilicore, Trillium, Eustilago, Veratramal. Dark and dotted menses. Dark and clotted menses it is. I'm sorry, there are a few spelling mistakes that has happened. Apis, Asarum europaeum. Asarum europaeum, these people, when they have severe menses, they're very irritated, and even the least sounds they are not able to bear. This is one of the best medicines when there is very sensitive, high sensitivity to sounds, like, they are not well, and if you make noise and they start, getting irritated. Bovista, Calcarea fos, Caulophyllum, Chamomilla, Simicifuga, China, Cocculus, Crocus, Cyclamen, Hamomalis, Helonius, Ignatia, Calimur, Creosotum. Dark and sometimes foul smelling discharges, which, little acrid. Creosotum, nitric acid also can be thought of. Lachesis, Lilium tick, Macphos, Nux moschata, Platina, Plumbum, Sabina, Sicilicore, Thalassobursa, Eustilago, Xanthoxylum. Now, what is vicarious menses? Instead of menses, in vicarious menses is the occurrence of cyclical bleeding from an extra genital site. So instead of menses, they get blood from other sites like nose, lungs, stomach, skin, gums, etc. during the menstrual period. So during the menstrual period, they are expecting the menses to appear, but instead of that, they will either get bleeding of the nose, or they might get some cough with little bit blood in it, or they might get, the bleeding of the gums, etc. These kind of things, which is called a vicarious menses. Common sites, nose, epistaxis, hemoptysis. So gums and nose is generally more seen rather than hematemesis and all. So from the stomach, it is called hematemesis. Intestines, blood in the stool. Urinary tract, there can be hematuria. Skin, if there is hematuria, one more thing is, please ensure we have to ensure that we are doing the ultrasonography just to rule out any kind of a stone, or you have to just give the urine for culture to rule out. Recently, I had a case in which there was a bacterial infection by which the person was showing scanty. Scan was normal, but it was showing scanty traces of RBCs. Then skin, very rare. All these are bloody tears, etc. Just a definition of vicarious. What are the medicines for vicarious menses? One is Bryonia, digitalis, erigeron, eupion, ferrum fos, hamamelis, ipecac, calicab, lachesis, millifolium, phosphorus, pulse, sabadilla, sanguinaria, sicilicore, sulfur, trillium, eustilago. Great weakness during menses, aletris, alumina, ammonium carb, calcarea carb, calcarea fos, Carbo animalis, Carbo veg, China, Cocculus, digitalis, ferrum metallicum, Helonius, Ignatia, MacCarp. Again, one more case recently. She responded very nicely to magnesium carb. So we won't think of medicines like magnesium carb immediately after a petrization. She was given magnesium carb, after which the menses stopped completely. That is, it was in the proper cycle. Nux moschata, Nux vomica, Pulsatilla, Trillium, Veratrum album. So what are the biochemics we can think of during delayed, tardy, scanty, suppressed menses? Ferrum phos also has to be included. Calcarea phos 3x, Kali phos 3x, Natrum more 3x, Kali more 3x, Kali sulf 3x. Metritis, bearing down pains, etc. as an anti-inflammatory. Ferrum phos, CP6x, KP6x, Kali more, Calcarea fluor 6x. Menorrhagia, heavy bleeding. Again, Ferrum phos 6x, CP6x, KP6x, Calcarea fluor, and Natrum sulf is also another medicine which can be given for Menorrhagia. So we will look at the first medication is Aletris. Sphere of action is uterus, ovaries, female reproductive system. Produces debility in weak anemic women. What are the key female complaints? Habitual tendency to abortion, especially from uterine weakness. So one of the best medicine as a uterine tonic is Aletris. And as I said, like one more you can think of it's Michella. So these two can be given as uterine tonics. Threatened miscarriage due to exhaustion or uterine atony because the uterus is very weak. Sterility associated with uterine debility. It is also given during prolapse of the uterus because of the relaxed pelvic muscles. Okay, this is one of the best medicines that can be thought of. Of course, the later on, the first degree prolapse or the tendency to prolapse, etc., we can think of all these medicines. Once it is beyond, then they will have to go for whatever is necessary. Leukorrhea in weak anemic women, profuse exhausting leukorrhea. Menorrhagia with marked weakness and anemia. Delayed or scanty menses in debilitated girls, very weak girls with delay or scanty menses. Irregular menses from general weakness. So the key thing in Aletris is the weakness. Bearing down sensation in the pelvis as if the uterus would fall out. Ovaries feel sore and aching with uterine weakness again. Backache, anemia, general weakness. What is a constitution? These people are thin, pale, chlorotic or anemic women, easily fatigued, or they feel tired all the time. So whenever these women come with menstrual complaint, but generally also even not during menses, they are always tired. We can think of Aletris as one of the best medicine. Weak digestion with poor nutrition. Clinical uses, uterine atony, recurrent miscarriages, menstrual disorders due to debility, leukorrhea, white discharge with anemia, prolapse subinvolution of the uterus. General features, great weakness and debility. They always want to rest. There are certain women who come to us because of the menstrual irregularities or menstrual issues. They feel, I don't feel like doing any work. I want to rest. I want to just lie down. Chilly patient, history of excessive loss of fluids, either in the form of bleeding. White discharge also causes weakness. This is another thing in Aletris. Frequent childbirths, like they have either frequent tendency to abortions by which they are, the cycle is continuously repeating, or they are frequently they have lots of children. We can think of Aletris as a tonic, which leads to anemia and weakness. So it's one of the chief remedies for female weakness, especially when uterine complaints are associated with anemia, exhaustion, and tendency to miscarriage. Second one is aconite. So we can think of it, as I said, it is one of the medicine I have given for a child who met with an accident, and she was around 13, 14 years. Still, they did not see any signs of, she was getting all the secondary characteristics, but her menses was not appearing. After taking the case, there was an accident that happened, after which the child has severe fear of, going in vehicles, etc. So after which aconite 10 mg was prescribed, and the child did menstruate. After a couple of months, the spotting started happening, and after later she menstruated normally. So what are the key notes? Female sudden onset of complaints, like every other aconite symptom, restlessness, anxiety, fear, as if something awful is going to happen, congestion of the pelvic organs. It is prescribed in the early stage of inflammation, even if it is PID or any kind of itis, metritis, anything. So at the first stage of it, we can think of aconite. If it is a sudden, if the patient comes to you immediately, we can think of aconite. Menstruation after sudden fright or cold, scanty or suppressed menses from exposure to cold, fear, shock, etc. Menses too early and profuse, bright red with restlessness and anxiety. Dysmenorrhea with burning, cutting pain, cannot rest. Threatened abortions from fright, fall, and shock. See, this is one of the major action we should think of aconite. Aconite can lead to threatened abortions, especially after a fright, after a fall, after a shock, etc. So generally when they come, we can, or probably if the person comes after a fright, or if you feel that they are prone to a threatened abortion, we can think of aconite immediately, which sometimes is a life-saving thing for the baby. Uterine congestion with throbbing, fullness, and bearing down. Leukorrhea, or white discharge, which is scanty, suppressed with heat and restlessness. Ovarian pains are there, congested, throbbing, sensitivity to cold wind, feverish conditions with dry heat, thirst, and anxiety. What are the modalities of the female modalities? Aggravation from cold, cold wind, dry cold, from fright, fear, shock at night and after midnight, from slightest motion or touch, during menses in painful cases, lying on the affected side during the first stage of complaints, amelioration, warmth, warm applications, warm room from covering up, rest, quiet, after free discharges. Let it be sweat, urine, menses, anything. But after the amelioration is after the free discharge. Sitting up, bending forward, modalities cannot bear even a draught of air, thirst for cold drinks, restlessness, anxiousness, fearfulness, better by sympathy, reassurance, sudden, violent, acute complaints. It is a remedy for acute onset of acute female complaints from fright, fear, cold, shock with great restlessness and anxiety and congestion. Acts best in the early stage of inflammation and suppressed or threatened conditions. Next is alosocotrina. This is a medicine which I've used for a person with, menstrual issues with the bleeding hemorrhoids. Frankly, I did not even think that this will give a good, the person had both of it. So as a medication, I tried Allos, but even the menses, which was generally very profuse for that person, started showing good results. So I just included this into this. Core indication is early menses, profuse menses, appears early with sudden flow, associated with, of course, bleeding hemorrhoids, congestion of the pelvic organ, profuse bleeding from rectum, concurrent with menses, aggravation, warm weather, heat, amelioration, cold applications, sensation of heaviness, fullness in the pelvis. Ambra gracia is the next one. It is a well-known remedy for delicate, sensitive women with irregular menses, painful period, and offensive discharge between periods. What are the keynotes of Ambra gracia? Discharge between periods, leukorrhea, or spotting between menstrual periods. That we said Metrorrhagia. But this, it can be offensive, acrid, or excoriating. So generally, the women come and say that the discharge is acrid, and sometimes the undergarments they wear corrode over there, like nitric acid, ambra gracia. We can think of all these medicines. Irregular menses, too late, too early, too scant or scanty, bearing down sensation, menses too soon, of one after the other, amenorrhea from suppressed menses or grief. Sorry. Menstrual features, menses early, profuse, scanty, irregular, dark, clotted, offensive flow, bearing down with pain in the back, weakness during menstruation. What are the general characteristics? Again, amblyopia women are thin, weak, delicate women, very irritable, anxious, restless, amelioration in open air, sensitive, irritable. They are easily provoked. One thing is amblyopia is they are very irritated. Like we can think of one of those menses, like women. They say like during menses or they're very irritated. One of the main medicines is amblyopia. They weep easily, feels everything deeply. It is more or less similar to pulse at love. They also desire sympathy and attention, fearful for the health of loved ones. Weakness, wants to lie down, chilliness, headaches, especially during menses, with digestive disturbances from emotions. See, it is very similar to pulsatilla in many of those. So I'm not going too fast, no?
No problem.
Oh.
It's fine.
Yeah. Second one is arnica. So menses is delayed, scanty or suppressed. It's one of the main medicines for sore, bruised, exhausted women with painful, irregular, suppressed menses from exertion or emotional shocks. So one thing which I generally give, if they say that they have full body ache during menses, I think of arnica. So these are medicines we don't generally think so much like in terms of menstruation, etc. But I've included all this so that we can think of like out of the box slightly. So this is another medication which is like delayed menses, scanty menses, suppressed menses, bearing down pain in the pelvis and lower back, sore, bruised feeling in the uterus, and pain from slightest touch, jar, motion, or exertion. See, sometimes when we go to examine them only, they will like, sometimes they'll wince. They'll say, oh, it's paining even if you touch. So bright menstruation, better from rest, nausea, vomiting, fainting, exhaustion, weakness, irritability. Menses, it can be delayed or suppressed from overexertion. So another thing is women who work a lot, they can get, delayed menses or suppressed menses sometimes, or it can be because of grief, anger, shock, bearing down pain in the uterus, as if everything will come out. It extends to the lower back and thighs. Another medicine good for dysmenorrhea, which extends to the thigh, is xanthocylum. Okay. Uterus feels sore, bruised, sensitive, flow scanty, dark or too early, nausea, vomiting, feel sore, bruised, overworked, sensitive to pain, touch, jar, everything. They're super sensitive, arnica, irritable, intolerant, and easily offended. Their sensitivity is so much so that even if you say something in their good, like, they might take it in a wrong way. So great prostration or weakness is there, better from rest, lying down, open air. Irritable, surly, or they are very irritated, easily angered, does not want to be disturbed. Do not touch me, do not disturb me. Let me just go lie down somewhere. Like, that is typical arnica. Feels everything more intensely, especially during that period. They are like, the typical touch me not. Anxiety about health and responsibilities, aggravation from motion, walking, riding, exertion, touch, pressure, jar, noise, anger, grief, suppressed menses, from rest, lying down, amelioration, open air amelioration, fresh air amelioration, gentle touch is fine. Open, quiet surroundings, physical generals, weakness, prostration, sore, bruised feeling in the muscles and joints, headache, worse during menses. Pulse is weak and soft, pallor, anemia, cold, sweat. Okay, next one. Apis mellifica. So last time during the menstrual, when I was telling about in the Malayalam session, I had told you, generally, Apis mellifica should be given in caution for any kind of chocolate cyst or the hemorrhagic cyst. Especially when we think of right-sided cyst, we might suddenly think of Apis mellifica. But Apis mellifica can sometimes aggravate very badly if, in certain cases. So Apis mellifica has to be given with caution during those times. It is one of the best remedy for menstrual disorders marked by swelling, burning, pains, and great sensitivity. So then scanty, delayed suppressed menses, too soon, scanty, burning, stitching pain. Yeah, usually some women come with urinary complaints along with the menstrual complaints. We can think of EPIS. But generally, EPIS should be given, according to me, after a good ultrasonography, after ruling out any other hemorrhagic cyst or anything of the kind. That is the best. That's a word of caution from my end. Great sensitivity to touch, especially in genitals, bearing down pains in pelvis, discharge between periods, acrid, burning, excoriating. General characters, they are weak, they are flabby, they are emaciated, weak, exhausted, irritable, touchy again. You know that typical EPIS characteristics. It is red, inflamed. If you touch it, it will pain, peevish, impatient, swelling of the face, eyelid swelling, genitals, limbs, edematous tendency. During menses, if they have any kind of edematous tendency, we can think of EPIS mellifica. Emulation in open air feels better in the open, worse in warm rooms and in night. Menstrual features, menses are generally scanty, delayed, suppressed. Burning, stitching pain in the uterus, swelling and congestion may be there. Discharge between periods, as I said, metrorrhagia. Menses too soon, profuse or scanty, bearing down pain in the pelvis. Again, these people are also generally, when a lady is in a not a normal cycle of menses, she is generally irritated. So I can say it's a generalized feature, but certain medicines show a little too much of irritability, and this EPIS lady will become very quarrelsome at that time. Many of these women get easily offended, but the EPIS will not, hesitate to quarrel with her partner or everybody around her. Impatient, restlessness, anxiety about health, fear, nervousness about the future, better by sympathy and attention. Emulation, open air, cold application, gentle pressure during menses in some cases. Aggravation, warm room, night, before and during menses from heat. Physical generals, weak, thin, flabby people, swelling of face, eyelids, edematous swelling, burning pain, sensitive to touch. Better in open air, thirstlessness with desire for small sips. Hasaram europeum is another one. As I said, this is one of the best medicines for irritability. Even if if you just, the noise of paper, rustling papers also can irritate them. So much they are sensitive. This I have used plenty in certain cases of, autism, etc., ADHD cases I have used it. So this is another medicine we can think of. Dark, acrid, offensive discharge between periods. It is one of the well-indicated medication for nervous irritability. So the nervous system is very, very sensitive. Painful, irregular menses, offensive discharges. Too early, too profuse, too scanty, anything. Suppressed with continuous leukorrhea. So most of these discharges are very acrid, accompanied by bearing down pain, backache, colicky pain in the uterus and ovaries, menses associated with nausea, vomiting, faintness. Another one we can think of is nux moschata. General, very weak, exhausted, prostrated. There are certain women who will tell us, doctor, during menses, I will faint. I'm so sensitive that I will once or twice, I will fainted. We can think of all these medicines. Very weak, exhausted, prostrated, or weak. Better from open air, aggravation, closed rooms, irritable, offended, nervous, oversensitive, VP. Chilly patients, worse from cold, better from warm, open air, emulation, open air, feeling better while walking in the open air. In general, they're better in open air. Menstrual features, too early, profuse, scanty, suppressed, but leukorrhea continues. In this, another medicine we can think of is borax. When there is continuous, ova testa, borax is for continuous leukorrhea, especially in young women. I even prescribe ova testa 3x also. Offensive, acrid discharges between periods, bearing down pain in the pelvis during menses. Pain extends to the back and thigh. Many of these features are very common in most of these medications, but I'm just covering it up. Nausea, vomiting, faintness during menses. I've already told this. Irritable claws, touchy, offended, sensitive, anxiety about health. This person also weeps, wants to be alone, open air amelioration, closed room aggravation, cold aggravation, night from mental exertion or worry, anger and excitement. Physical symptoms are thin, emaciated, chilly patients, sweating of head and face. We can even think of calcarea, silicea, all those. Aversion to fat food. Aggravation fat food, pulsatilla is there. Nausea, vomiting during menses, headaches, especially during menses, pain in the back and pelvis. So is there time? Hello?
സമയമുണ്ട്.
How many slides remaining?
Few more slides, sir. That's all. I can go on. So we'll just finish one or two more, sir.
Okay, 2, 3.
Okay. Yeah. So belladonna, another one. One of the key remedy for menstrual complaints. Sudden suppression of menses, again from fright, anger, sun exposure, getting feet wet in the rain, etc. Delayed or scanty menses. Menses come too late in small quantity. Congestive menses, throbbing, pulsating pains, fullness in the pelvic region. So this can be thought of both scanty as well as dark menses, belladonna. Dark, profuse, clotted menses with constant bearing down sensation. So there are many, medicines which has bearing down sensations. Acute, violent menstrual pain with cramping, cutting, stitching pain, aggravation, slightest touch and motion, heat, throbbing. Another main feature of belladonna, which, they have red face, hot flushes, throbbing, sensitive to light, noise, touch. And generally, these women sometimes most of these women get headaches, etc. Irritability and restlessness before and during menses with oversensitiveness and aversion to company. They are sudden, intensive, sensitive with congestive symptoms, headaches, nosebleeds. Bovista. A deep acting remedy for suppressed, delayed, or painful menses, dark, offensive discharges bearing down pains. So I've told you just a case earlier. This person had gone to and taken the medicine called pause for a couple of days, in spite of which the menses was not stopping. And I took a few, after repetization, Bovista came. After which the patient has shown considerable, amelioration after giving Bovista. Menses is late, delayed or suppressed, scanty, dark, thick, offensive discharge between periods, bearing down pain in the back, pelvic, thigh, painful, difficult menses, lumps, congestion, and fullness in the uterine region. Menses too early after the previous one. So just one menses got over and the second one started immediately. Bovista is another good medicine for that. Nausea, vomiting, faintness during menses, weak, exhausted, low vitality, overwhelmed by the slightest exertion. Because these people, just before, by the time the first one is over, the second menses is starting. Naturally, they cannot, even if I lift up anything, doctor, I'll start having a menses. They are irritable, cross, easily offended, mentally dull, inability to concentrate, weeps easily, discouraged, fearful about health and the future, amelioration in open air, aggravation in closed, rooms and nights, etc. Being alone, basically. Menstrual features: menses is delayed, scanty, suppressed, dark, thick, offensive discharge between periods. So this is Bovista, one of. So we must have thought of like bindi allergies, that impression on the hand, all those we can think of. And dark, thick, offensive discharges is like, one of, and in big clots, this person, the case which I spoke about, no, it was big clots and it was bad smelling. It had a bad smell and it was pretty thick it was. Bearing down sensation, pain in the lower back, thighs, menses too early, nausea, vomiting. Quarrelsome again, they are irritated, quarrelsome, easily offended. See, these need not be until, of course, the person is grossly anemic, very tired. Any person will get irritated. Dull, difficult to think and remember, weeps easily, anxiety about health, aversion to company, desire to be alone. Open air, gentle motion during menses after the flow has started, all amelioration. That worse, closed rooms, night, cold, before and during menses, mental exertion. Generals, weakness, wants to lie down most of the time. As I said, they are continuously bleeding. Chilliness of cold hands and feet. So chilliness, cold hands, cold feet. There was one case in which I have given agaricus, which was like a frostbite kind of sensation. It was a very cold region this person called up from, and that person used to get frostbite kind of symptoms in her hands along with menstrual irregularities. Agaricus had given me a very good, result with that. Headache, especially before menses, we can think of Bovista. Nausea, vomiting during menses, pain in the back, thighs, and hips. Cactus is the next one. It is one of the valuable remedy for Metrorrhagia, Menorrhagia with clot bearing down pain in the pelvis or uterine region. The menses is too copious, clots is there, bearing down pains is there. These are the main thing. Bleeding between periods, early copious with clots. Big clots are there. Menorrhagia, menses early, too abundant with clots, pitch-like. They are like dark clots, coculent clots. They are big clots. The cactus main thing is clots. Bearing down pain, pressing, bearing down pain in the pelvis or uterine region, palpitation, low BP, feeling of weakness, better in open air, aggravation, motion, going upstairs, etc. Crocus sativus is the next medication. Menses is delayed, scanty, painful, dark, thick, stringy clots. Flow usually scanty, comes gushing in or in drops, bearing down cramping pain, lower abdomen. Pain better from heart pressure, warmth, bending double. So it is one of the best medicines for spasmodic painful menstruation. That is dysmenorrhea with scanty flow, dark clots, amelioration, warmth and pressure. Irritable before and during menses, discharge between periods, brownish offensive discharge. So most of the medications we can either, first and foremost, we can, divide it as dark blood, light, the light colored blood. So many, you can, come to certain groups of medications that way. So this falls in the dark bleeding. General characteristics is spasmodic cramping pains, irritability, touchiness again, anger, quarrelsome, sensitivity, better from warmth, pressure bending down, double, cold aggravation, during motion aggravation, open air amelioration. Menstrual features, it is menses is delayed, scanty, painful, dark, thick, stringy clots, passed with pain. Flow comes in gushes or drops, bearing down pain in the lower abdomen and back. Back, another medicine, back pain, severe, trillium, we can think of. Pain better from hard pressure and heat. Discharges between periods. Mind disposition, again, irritable, offended, quarrelsome, hypersensitivity, depression before and after, menses. The typical PMS symptoms, we can think of Crocus sativus, anxiety about health, amelioration, warmth, heart pressure, bending, double, open air, walking, cold, aggravation during motion, lying on painful part.
2 minutes more.
Doctor, let us conclude the session for the time being. And
Yes, doctor. I'll just finish off this one. Okay.
I would like to ask a question.
Yeah.
Doctor, how will you manage a case? Today I got a case in which the lady has just 42 years old, and she had a bleeding. She had a misbleeding on last April, and
Yes, sir.
on June she visited a gynecologist, and because she has severe bleeding on the next time, and it lasts for about some more than 2 weeks, and it was still persisting. So she visited the gynecologist, and she all of a sudden she gives some medicine, and then she what she done is she took done as DNC and asked her to take regular medicine, and she took a biopsy also. It was negative. So the patient was asked to continue the steroid treatment for 6 months. What's your opinion? How we can manage that case?
So generally, this is a perimenopausal symptom, is what you're trying to tell me. It is like,
Yes.
can I stop sharing?
Yes, that I have stopped.
Yeah. So it is like we can look in terms of perimenopausal periods, like, so they have done the scan and everything. So I think we will just go for all the menstrual, the hormones also.
Yeah, so all
So,
this were done. My question is whether shall we ask her to stop the steroids and continue with homeopathic medicine? Or
I have done it in
whether,
my personally, I have done it because they have already done the DNC for the next few months anyways. They're not going to get any major issues immediately.
so better not to advise to take any steroid for as advised by the doctor.
Of course, because the DNC has already been done, they have cleaned up the whole thing. So now she is not going to have any problem at least for the next 3 months. So we have a good window of 3 to 4 months.
Yes, whether we will have to continue with homeopathic medicine or
Yes,
not.
of course. We have very good medications. We can think of Viburnum opulus. You still have so many medicines are there. But then, of course, we have to repertorize it, find the prolactin level, FSH, LH, all those. And on that basis, we can think of.
Okay, thank you, thank you. Since
Pleasure.
our time is over, we have to
Yeah.
conclude the session because another session is the guest is waiting. So
Okay, sir.
with that, we come to the end of the session, and we
Yes.
can have some more presentation in the future. Hope all of you will join us tomorrow at the same time. Thank you,
Okay.
all. Thank you,
Thank you, sir.
Asha
Thank you.
B.Varghese, for
Thank
an
you.
excellent session.
Thank you, sir.